In 2002, NAC came with a manifesto under President Kibaki. In 2007, there was a second manifesto under President Kibaki. In 2013, President Uhuru Kenyatta came with a manifesto under the TNA-URP coalition. In 2017, the second Uhuru Kenyatta administration manifesto. All those 4 manifestos, we had attempted to do some of the things we are doing now. We had said some of those things in the manifesto, but we were not courageous enough to implement some of those things. Take universal health care, for example. NAC wanted to bring universal health care under President Kibaki when Charity Ngilu was minister, and I think Anyang' Nyong'o at some point. Because of political backlash, we pulled away from implementing universal health care because of politics. President Uhuru was a little bit more calculative. Unlike President Kibaki, President Uhuru never introduced universal health care in the first term because the challenge was politics. He decided to wait until he gets re-elected, and then he comes with the Big Four agenda. One of the Big Four agenda was universal health care in the second term in 2018. But even then, President Uhuru was unable to lift off universal health care because of politics. We backtracked a second time. It is therefore important for the country to know that this administration will go down in history as the administration that faced head-on the challenge of inequities and inequalities around the provision of health care, and have come up with a groundbreaking program to implement universal health coverage, lifting millions of people from the vagaries of helplessness, from a public medical insurance scheme which existed with only 7 million members. Today, we are celebrating 26.5 million Kenyans already registered into universal health coverage. The target by December 31st is to have 30 million Kenyans enrolled. The target by December 2026 is to have between 42 and 47 million Kenyans registered. And the target by December 2027 is to have 56 million Kenyans, every Kenyan with a medical insurance card. That is phenomenal. It doesn't happen anywhere. I am not aware. Even some of the most developed countries have struggled with universal health care without much success. President Obama introduced Obamacare in 2016. It was challenged. It faced political resistance. It went to the Supreme Court. The Supreme Court ended up mutilating Obamacare, and only the vestiges of it remain today. So what we are doing here should not be taken lightly.